All right, so thank you guys for coming to my presentation. I interned with the Mid-Atlantic Permanente Medical Group over the summer. So this is for my internship capstone. And so the main project that I worked on was really just optimizing the patient outreach through using EHR data insights. I don't know why it's not switching. Okay. So just for the background, I'm going to go over a little about MapMG and the quality improvement team and some of the systems and tools that I was able to use with them. And then I'll go into the project that I did and then the outcomes of both the project and my internship experience with MapMG. So just as a disclaimer, some of the specific details I can't really go into due to MapMG's proprietary rules, as well as the personal health information and HIPAA privacy rules. So if I seem a little vague, I apologize, but I'll try to do my best to answer any questions. Sure. So yeah, a little bit about MapMG and the quality improvement team. So MapMG is a health provider group that serves roughly 800,000 patients in the region. So this includes Northern Virginia, Southern Maryland, Washington, D.C., and the Baltimore region. And they work exclusively with the Kaiser Permanente health plan. So the regional office that I worked with, that is in Rockville, Maryland, and that's actually where I had to relocate over the summer. So that was a fun experience. Yeah, and so the quality improvement team is part of the larger quality department. And what they primarily do is kind of monitor the quality components for healthcare. So this includes HEDIS measures as well as CQC, which is critical quality components. And that is like an internal quality measure that MapMG uses. And so the QI team, they primarily monitor this, and they do this through a PDSA strategy, which is Plan, Do, Study, Act. And they kind of just monitor like any discrepancies in the quality measures, and they do like a root cause analysis of this. So they'll like collect data, analyze it, and then kind of produce any potential solutions or interventions to kind of improve these measures. Then they'll implement it, monitor, and see if there's like any change. And if there isn't, they'll keep iterating until there's a positive change. So these are the tools that I primarily worked with. So Epic is the main EHR system that MapMG works with. So this is actually called Health Connect. So there's patient charts that I was able to look at, some records, and dashboards that kind of helped me inform like what the data points are and kind of like to verify the information that I was looking at. And then from that, I was able to also use the Oracle SQL developer, which is, so I was able to use that to kind of query any tables, which again includes like a lot of diagnostic information, patient records, all that. And then Tableau was like an easy way for me to visualize any, like all of that information that I was able to query. So sometimes it's like thousands upon hundreds of thousands. So it's kind of hard just looking at the table. So Tableau was a quick way to visualize any patterns or trends that there are with these tables. And then lastly, Python. So Python, I mainly use Python to kind of manipulate some of the data and build any like calculations if there was any. So the data package I used was pandas primarily, and then after that, there was also sklearn, which is a machine learning package. So sklearn, the machine learning model, I used like logistic regressions and random forest classifiers. Sorry, there's like, okay. So this is the systems that the data flows through. It's like, I couldn't really share like specifically what MapMG used, but I think this was a good way to kind of visualize like the data flow for Health Connect. So Chronicles is like everything that's loaded the day of. And then it gets loaded into Clarity, which is like the database of like their whole history. So clarity was mostly what I was querying out of for my information. All right, so for my main project, I used sorry. So for my project, I was mainly focused on telephone outreach analysis for patients with overdue appointments. The objective for me was to kind of optimize the patient contact list for MapMG's regional population care call outreach so that a greater proportion of outgoing calls achieve a patient response. As it stood, there was less than 50% of patients who were answering the phone, and so we needed to know if we could get more patients to respond to the phone by optimizing the right set of patients. So the target outcome is to really increase that contact rate and more so increase the compliance rate for patients that were overdue for care or any like necessary screenings and tests. Okay. A little bit about the PPHO. So PPHO is the Personalized Population Health Outreach Center. It is dedicated to making phone calls under the guidance of the quality department, which is physician-led. And so call information is provided to the outreach representative through a dashboard that the data analysts prepare. So the call outcomes, though, is reported via a Tableau dashboard, which is separate than the dashboard that they're fed into. All right, so this is kind of an overview of like the methods that I use to do my projects. So we first chose the A1C population dashboard. Um, we first chose the A1C population instead of just doing all of the outreach population, and that's because it was a little bit of a smaller size, and the measures were easily measures. There was an easily measurable outcome for that. So from there, we went on to like information gathering, data collection, and doing a summary analysis to determine a set of features that we could use as predictors. This was just looking at academic studies and healthcare articles. And so they provided some insight on the demographics and health behaviors that we could use as predictors. From there, we queried information that contained those predictors and then visualized that using Tableau. So Tableau visualized if there was like any patterns between the factors that we did need. From there, we extracted like a final table, and then well, first we gave those features to like the data analyst to implement first, and then we made a final table because the first set of results that we did not have significant outcomes. So from there, we built and tested machine learning models using these tables as training and learning sets. And then we iterated again to implement to all patients with active coverage. So this was one of the Tableau visualizations that we did using the A1C population. This really just shows that patients with less days between the last result date and the last call date have a greater contact rate. So they went from 40% with like minimal number of days, and then as the days in between become longer, it goes down to 30%. Similarly, with the number of office visits and outreach, there's so with less number of office days and outreach days, so with like lesser number of office visits, there was a lower level of contact rate, and then with greater number of office visits, there's there's a greater contact rate. And then there's a similar trend with age, where as they get older, there is a greater contact rate as well. There's a few other visualizations that I made that kind of illustrate similar patterns with all of these features right here. So we found that age, gender, race, number of appointments, coverage type, which includes like commercial, Medicare, Medicaid, and then the online portal status. So that's like the my chart and then the day since their last login from my chart. So these were all pretty influential factors as contact factors. So in the first implementation stage, we only used age, gender, race, and coverage type as a filter, which we gave to the data analysts. And from there, we looked at the Tableau dashboard to see for any changes. In that week, there was like a marginal increase, but it wasn't significant. It was like less than 2%, which at any given week, it could fluctuate that much. So we couldn't be sure if those predictors were actually working. So from there, we went on to use machine learning models. So these are all the models that we looked at, and then the percentage that you see is like the accuracy rates. So as you can see, it's kind of low, but it's better than 40%. So we went with the logistic regression and random forest classifier as machine learning models. And so we trained it on all patients that have been contacted, and then kind of applied it to everybody that has active coverage. So the outcome of that was this table. So this table, it's contains like the probability that someone doesn't answer, which is like the LR prob NA, and then the probability that they do answer, which is like the probability A, and then the final prediction from that particular model. So with these models, there's like some disagreement, which is morally, it's like pretty much attributed to the fact that the accuracy is just kind of low. But it does give like a good guidance on who's likely to pick up and who's less likely to pick up. And we gave this again to the data analysts for the outreach, and we found that it did work. So when we implemented it for the first week, we found about an 8% increase in the contact rate. So by looking at, this is kind of like snapshot of the dashboard. So looking at this column, we found that, yeah, there was about an 8% increase from the prior week where it wasn't used. And then in the following week, there was about a 9% increase. So that indicated that it was that was sustainable, that improvement, which is good. So moving forward, we continue to expand this prediction table to more WHO population cohorts. So the success of this project, it did come with a few challenges. The first mainly was that predicting behaviors, especially with just whether someone's going to pick up the phone or not with personal health information, that is challenging. So even if we did have all the information we have about their lives, it's still an unpredictable behavior, just because there's a lot of like outside factors that could influence that behavior. And then on a more personal level, just being an intern, learning all of the systems and workflows and tools at my disposal, it was a little bit challenging, but it was a good challenge because that means I was being exposed to a lot of new things that I hadn't really tried before. So that was a really good experience from that. Especially with navigating the Clarity database, that was a little bit hard since that was like the first time I really delved into it. And then the implications. So for this project, the implications of it really lies in its potential impact to improve patient healthcare outcomes. So by increasing the contact rate, we are giving patients critical health information and making those necessary appointments that ultimately leads to improved care. And so that would first improve the quality measures that the quality improvement team is working on. And then also it would basically enhance the organization's standing as being one of the top providers, the top medical groups in the country. So for lessons learned, for me, there was a lot of technical skills that I learned. So from working on the PPHO projects, I really improved my skills using the SQL developer, as well as Tableau and Python. And so it wasn't just these tools in itself, but it was how they all worked together to kind of provide valuable data insights and how these insights can really tell a story. And also by using these tools, I was able to implement an improvement. So those skills were really important. On a professional level, I think I really learned the value of quality assurance. So kind of double checking the information that I have and making sure that the way I'm interpreting something is correct and not misled by something else. So that was a really valuable skill. And then also being able to pivot when a test turns out unsuccessful. So we did hit several roadblocks, but being able to kind of like look in a different direction or look at something from a different perspective, that was also a skill that I learned professionally. And then lastly, this internship provided the career insight of working in quality improvement in a healthcare setting. So the experience was really valuable in that regard, and I can definitely see myself using these skills and experience both in this realm and in healthcare and in any future professional career. I think it's my last slide. Okay, yeah, thank you.